Getting some news that you have either a pinched nerve or a disc bulge is usually pretty upsetting. I want to try to be optimistic for you and give you some of the good news. Most of these pinched nerves and these disc bulges, they can heal. Nerves can heal, they can regenerate, and disc bulges can reabsorb or at least be minimized enough that they don't become so problematic. A lot of people get very scared when they hear those terms because they immediately think surgery, and although some of the extreme cases can mean surgery, most of them, however, do not necessarily. So I want to give you some strategies on trying to get the body to heal naturally so that you can possibly avoid some of those more invasive therapies. The first thing to consider is inflammation and controlling inflammation. One of the first go-to medicines that they will give you is an anti-inflammatory. They will recommend a non-steroidal anti-inflammatory. These are the over-the-counter aspirins and ibuprofens. A lot of times they'll give you something stronger, such as a steroid, a prednisone or something like that. And those are fine, and you should probably take those, especially if it's fairly severe and you're getting a lot of that pain either down the leg or down the arm. But some other things that you might not know about are that a lot of the foods that we eat in our common everyday diet are very inflammatory. These are a lot of the refined foods, anything that you find in a box, a bag, or a can. Refined sugars, refined carbohydrates. I have a link below that has information on foods that you can eat, so I would encourage you to read that blog post. But really, these are foods that will create inflammation in the body. So if you can avoid those foods, when you get a diagnosis such as a pinched nerve or a disc bulge, this is the time to take the best care of your body that you possibly can. The body is a self-healing mechanism, and the more things that you do that are healthy for the body are going to be healthy for that nerve as well. Get that body to heal. Number two, the second thing that you can do is avoid injuring the area any more than it already is. So this is staying away from activities that bother it. This is not the time to decide, I want to run a marathon for the first time in my life, or I want to break a record with my bench press or my deadlift, or whatever it is. This is the time to let your body heal. This doesn't mean that you shouldn't exercise. It just means that you should exercise safely. Avoid strenuous exercises and absolutely avoid anything that bothers it. Consider a scab that's grown over, and if you just kept picking at that scab, and every time another scab formed, you just picked at it, you're not allowing the body to heal. And the same thing happens when you get a little overambitious with maybe some physical goals while you have a pinched nerve. I bring that one up because a lot of people will experience these kinds of pain right when they get into maybe a new exercise routine or something like that. So it's important to know that this is the time to back off. Find a good therapist that can help you navigate those waters and decide what would be safe exercises for you and what would maybe be too much that you should avoid. Another example could be stretching too. I should have mentioned that. Say you're doing a yoga class or something like that. There are certain stretches or stretching too much that can be very aggravating. Sometimes it needs to stabilize. These are things that are difficult to determine on your own, and you might need some help with that. But it's definitely worth pointing out that you've got to let that body heal. So that brings us to the third thing, and that is find a good therapist. There are so many techniques that can be utilized to help the body heal naturally. These can be traction or decompression techniques. If there's a lot of pressure coming down on the spine, from the spine onto the nerve, you might want to open that up and do some traction or decompression on that. There are what are called nerve mobilization techniques in neurodynamics, where a well-trained therapist who knows how to use those techniques can actually gently mobilize a nerve back and forth to help speed up the healing process. And then there are, of course, the massage, myofascial release that could be good, or it may not be good. That's why you need a good therapist to decide, is this one of the cases where massage would be good, or maybe not so much right now, it's too inflamed and too irritated. Spinal manipulation in areas other than where the nerve is irritated can be really good. Structurally and mechanically keep the body aligned so that everything can heal properly. And then another thing is, when you find those therapies that work well for you, make sure you do those home therapies. So when is it time to say enough's enough, none of this is working, and I'm going to need to find a neurosurgeon or an orthopedist that works with these? Those are usually going to be when the pain is just so unbearable that you cannot take it. Usually long durations. The recommended treatment plan for these, or they recommend conservative treatment without any surgery or anything like that, some chiropractic or some physical therapy. It's recommended to do that for about 6 weeks while somebody's monitoring you and seeing, are you slowly getting better or are you slowly getting worse? The other big sign is muscle loss or muscle wasting. If certain muscles related to that nerve distribution, wherever your nerve is irritated or pinched, if you are starting to lose muscle tone in those areas, and especially if you start to lose too much strength. Now in the beginning, people will lose a little bit of strength. Oh, my grip's a little bit weaker there. That's not so concerning. It's when your grip is getting worse and worse. When your foot, you got foot drop and your foot just, you can't raise it up anymore. When those things go on for too long, that nerve becomes damaged to the point that if it goes on too long, you're not going to be able to get that back, or it's going to be very difficult to be able to get that back. And so again, we have a lot of resources in the information section below, but hopefully this will help give you some ideas to heal the body and give you some motivation to try these ideas out and heal your nerve.